To test your call quality, record a short message after the beep.
Okay, hello everyone. Just as a reminder, we are being recorded, and by being on today's meeting, you are giving consent to be recorded, and it is being live streamed. And then also, before you speak, make sure to state your name so that everybody knows who is speaking. All right, Candy.
Thank you, Brandy. This is Candy. I'd like to call the meeting to order. Roll call, please.
Candace Clevenger,
Here.
Paige Toth.
Here.
Vivian Goodman,
Here.
Jan Hack, Dr. Jerger,
Here.
Mary Jane Linton,
Is that it?
no, Mary Jane,
You're muted, Mary Jane.
I'm muted. I'm
There you are.
sorry. I'm sorry.
okay. Dr. Menegatti, Dr. Patterson,
Dr. Patterson, I think you're muted as well. I do see that Dr. Patterson's in the meeting, but I can't hear her. Sandy.
okay, do you want to proceed? Phil Tibbs, Laura Zimmerman,
Here.
that's all.
Okay, thank you very much. You received a copy of the agendas in your packet. Are there any additions to the agenda?
No.
All right, I need a approval of the agenda topics.
So moved. This is Paige. Second, Vivian.
Thank you, Vivian. All in favor?
Aye.
Just as a reminder, we do need to do roll call for all votes on here now.
Oh, thank you. I forgot. Roll call vote.
Sorry, I should have done that.
Candace Clevenger,
Yes.
Paige Toth,
Yes.
Vivian Goodman,
Yes.
Dr. Jerger,
Yes.
Mary Jane Linton,
Yes.
Dr. Patterson,
Yes.
and Laura Zimmerman.
Yes.
Thank you. Any public comments?
We did not receive any public comment, and there is no public here tonight.
All right, thank you. The previous minutes were included in your packet. Are there any changes to the minutes? If not, I need a motion to approve.
So moved.
A second?
Brett.
Thank you.
Yes.
Dr. Jerger, thank you. All in favor? Roll call vote, sorry.
Candace Clevenger,
Yes.
Paige Toth,
Yes.
Vivian Goodman,
Yes.
Dr. Jerger,
Yes.
Mary Jane Linton,
Yes.
Dr. Patterson,
Yes.
Laura Zimmerman.
Yes.
All right, now we'll move on to communications. Brandy?
We did have, and I might have missed something. I apologize, 'cause I was checking the chat. Did you all approve both of the sets of minutes there? For the July 21st and then also the Board of Health special meeting?
No, we just did the previous minutes.
Okay,
So included, sent out in an additional email were the minutes for the special meeting. So do I have a motion of any changes to those minutes? Do I have a motion to approve?
Laura, motion to approve.
Thank you. A second.
Paige, second.
Thank you, Paige. All in favor of approving the July 14th minutes? Roll call vote, please.
Candace Clevenger,
Yes.
Paige Toth,
Yes.
Vivian Goodman,
Yes.
Dr. Jerger,
Yes.
Mary Jane Linton,
Yes.
Dr. Patterson,
Yes.
and Laura Zimmerman.
Yes.
Thank you. Now for communications.
Okay, so just board education, and we're going to do COVID-19 update again, as I know we have been, just to keep you all as updated as possible. Of course, I had sent you an update email, I believe that was last week, just to kind of give you an idea of how things are going here. So just to kind of touch on that and then elaborate a little bit, as you all have probably seen, there has been an outbreak, an increase in cases and outbreaks in our community. We've gotten a lot of questions about where these originating from, and can you pinpoint, specific sources? And as you know, general practice in communicable disease is that we do not tell where each case is from. We could give an idea of what types of things are occurring that lead to outbreaks or increases in cases, but we're not identifying a location unless there ends up being a public health reason to do that, which we have not found at this point. It's various workplaces, it's gatherings that people are having, trips that people are taking. So it's really across the board. We're definitely seeing community transmission and community spread where you can't always tell where someone was exposed. So we'll continue to put, information out, but we're not going to list every single, workplace that there are cases. We certainly work with the workplaces and make sure that they know and that they're contacted as quickly as possible in that contact tracing process. But to adhere to privacy and decrease stigmatization and protect the confidentiality of everybody involved, we do not publish the name of every single, place that there's a case. That also wouldn't be manageable at this time to do, just because of how many cases and the spread of those cases. As I had sent you in the email, because of the increase that we were seeing internally, we did decide to contact our county and city partners to call a press conference July 27th, and we also, asked city and county if there was more that they could do to assist with the enforcement side of things, because as we've explained to you, there was not a lot of, teeth behind the enforcement. So there were these preventive measures that were recommended or required, but really no way to back those up or enforce them. We as the health department have obviously been doing our due diligence and following up on those. We have a three-step process that we follow where we do, a friendly educational call, and then we go do a visit to see if the complaint is founded for non-compliance. And then if it is a type of business over which we have, jurisdiction, or if they have a license through us, then we would issue a cease and desist order if appropriate. So that's what we were doing. That has been extremely busy and time consuming. And then, as you know, there, was the change with the administrative rule that gave more enforcement ability to health departments and boards of health and some other entities as well. And also, after the city passed its ordinance, they reached out to us to attempt to partner regarding the complaints that they were receiving and enforcement methods that they wanted to pursue. So they're looking for a partner basically to do what we are already doing internally and follow some of the same steps that we follow, but to go outside of the businesses that we regularly have that jurisdiction over. The police department also in that partnership has offered to follow up on those cases more, where we did not have, from any local entity, anything enforcement wise beyond what we were doing before, if you all remember that. So then after that conversation started, that administrative rule came through. So obviously we reached out to the state's attorney's office to get guidance about how we should and could proceed before we changed or did anything or had any additional conversations regarding our process. Certainly, we've communicated to, our partners what our process is, so that everyone is aware that we are doing our due diligence and we aren't just sitting on complaints. We've been very active with those, and Kathy's been handling those and going out with some of her team to make sure that those are being addressed promptly and adequately. So right now we're still waiting to hear back from the state's attorney's office. We did get a little bit of information just in the last day or two, but we're seeking more as far as what we should or could be doing in order to address noncompliance. We also at this point are considering possibly hiring a part-time staff person to assist, because primarily some other people assist with getting complaints, but they are pretty much forwarded to Kathy and she's following up on them. And she has a lot of duties in environmental health, emergency preparedness, and COVID specific, so we need a little help there. So we're working internally to figure out how we can possibly hire someone to assist with that. Contact tracing, as you can probably imagine, has been incredibly busy with the increased number of cases and the number of contacts that each of these cases has. As we've talked about with you several times, we did have, other nurses in the building trained. Now we've had a significant number of staff throughout the building that have been trained. That number has grown a lot, even just since last month. There are a lot of staff throughout the building who have stepped up to assist in making those contact calls. Our nurses are doing that initial case investigation, and then we have people throughout the building who are stepping up day, evening, weekend to assist the nursing team in getting that done, because obviously there's only so many of them and only so many hours in the day. And in addition to contact tracing, we are also still holding our TB clinic and vaccination clinic. These things are obviously still very important, and it's going to be critical that people are getting their back to school vaccinations, that they're getting their flu shots when those come up. So all of this hiring that we're doing will certainly be able to get our nurses back to mostly what they are doing on a regular basis. But right now is just obviously a very difficult time in a pandemic, and we're hiring people as quickly as we possibly can. But it doesn't feel fast enough when the numbers are growing the way that they are. Thankfully, we've been able to make all these calls and contacts, but as you can probably imagine, it's been a lot of hours and not much of a break for the staff. So we're really excited, again, that we got that grant and that you all approved our plan with that, so that we could hire. We have already started some staff, part-time and full-time, that are in their training time period and should hopefully start being able to take some contact calls either this weekend or next week, which will be huge. So we're really excited about that. And we also did some restructuring with that grant. As we had mentioned to you, some different positions in nursing in addition to COVID-19, and then also some support in fiscal for Cherie and all the duties that she has, and then also IT and all of the duties that he has, especially with the growing need and the growing number of employees that we have. So we're really excited about those structural changes that we're making. There's also, like we had mentioned, the health equity, diversity, and inclusion position that we have not posted yet, but that's a priority for us to get posted that would support the entire health department. There are also positions that are being filled by divisions that had been open even before the COVID response started here locally, that some of that got put on hold, of course, and so we're getting some of those positions filled now too. So there is a lot going on here. That is definitely an understatement. I will say that the directors of the division have been, I can't say enough on this meeting every month how amazing they've been. They're patient. They go far above and beyond what they probably ever thought they'd have to do. And I'm telling you, these supervisors regularly don't really ever get a day off, because even on their day off, they're getting called or texted about something that might come up. We obviously have done a lot of work in the last few years to have succession plans and backups for our supervisors so that they can have more days off to just be separate, of course, outside of a pandemic. But during this pandemic, they just have been phenomenal, and I can't publicly thank them enough for everything that they have done and continue to do, no matter how tired they are. So very grateful for them. And then also some of the things that I've seen from the staff throughout the building have just been amazing. I mean, we know that we have a great team here, but them reaching out to me, weekend days, evenings, is there anything I can do to help? Are there any more calls that need made? How can I help you? Anything like that. And I just, people have just every single day done that, and it's staff at all levels through all divisions throughout the building, and I'm just incredibly grateful for them. So I don't think that health department staff get enough recognition. We can tell them all the time how great they are and how good of a job they do, but it's always nice for them to be thanked or noticed publicly. So we certainly tell them when they get kudos from other people outside the organization, but I just wanted to take a second to let you all know, you always have difficult situations, especially when you have something like a pandemic or a very trying time, because it's very stressful, I think, personally and professionally for everyone. But we really have had, strong, resilient staff with extremely positive attitudes in probably one of the most difficult times in all of our lives. So thank you to the staff, and of course, thank you to the board, because I realize all of you have plenty of other things to do, and your schedules are more busy or busier than usual right now too. And thank you for continuing to take the time to be with us every month, and then beyond that, even when you have been. So thank you for that. And then one other quick thing I just wanted to let you know, if you haven't seen it, we do have the IDPH mobile testing unit coming here starting on Thursday, and they will be here through the 25th. And so we're really excited about that. We have excellent partners in our community whom have offered testing throughout this time, but significant numbers call for more testing needs, and community partners are working on that, and you'll hear more about that soon. But in the meantime, we are grateful that IDPH is going to come here to serve our community. And then also, one thing I wanted to let you all know is we did put something out to school superintendents with whom I don't know if there's one school district in our community that we haven't spoken with in great detail. I mean, they all have been very involved and very proactive in speaking with us to make sure they're doing things as safely as possible. We did put something out through the Regional Office of Education, just basically ensuring that they all know we're here as a resource and as a support. And, you know, as we get information, we'll continue to provide that to them. We did also in there, you know, mention that, you know, the public health stance or perspective, of course, especially with increased numbers, is that virtual is going to be the least risk of exposure to COVID-19. So there were some rumors that came with that we were mandating or telling school districts that they had to go virtual. And of course, we've addressed any of those calls, emails, social media messages that we've gotten to clarify that. But I did want you all to be aware, just in case you hear anything, that you can help clear that up or just forward them to me, and I'm happy to explain more to them. So that's what I've got today. And if anybody has questions, I'm definitely open to answering those.
Do you know how many tests that they might be able to do?
You know, I'm not sure. That's a very good question. I can find out, though, and let you guys know. I know that they're going to be running from 8 to 4 on each of those days.
What was the question? I didn't hear the question.
How many tests they can do while they're here?
You know, I don't know if this is the time to ask you this or not, but what about like senior students helping with contact tracing? Would that be an experience? Nursing students, would that be an experience that they could help with?
I definitely am open to that. There's a lot of training that they're required to complete.
Well, that'd be okay, though.
Yeah, and we would have, you know, of course, confidentiality forms, just like whenever we have nurses here. But what our goal is obviously to hire enough for the response. But seeing what we're seeing right now, I feel like we never know how many is going to be enough or how intense this is, much more intense this could get. So if they're interested, certainly, you know, Mary Jane, if you want to talk more or reach out to me, I think the more people we have trained just in case, especially with them being nursing students, because there's obviously some levels of experience that people need to meet in order to be contact tracers, and then there's required training. But definitely nursing students are a group of people that we had talked about in the past that might be interested in applying for the position. But we certainly take volunteers and use volunteers as appropriate as well. So definitely, you know, that's something that we can talk about. I think the more that we have ready, if we don't need them, then, you know, great, but it's better to have more and not need them than not enough.
Well, it could count as clinical experience hours, so they would be volunteers. They wouldn't be paid.
Yeah, I definitely think that's a possibility. I will say that the challenge is becoming, and we're looking at ways to set this up internally too. It's difficult now because of COVID to even be able to get computers, you know, fast enough. MiFis for people to have internet that are going to be working remotely. Then when you add more people that are in the building, you know, you need more access points for the internet. So I definitely am interested in that. And maybe if they could even complete the training on their own equipment, and then if we needed them, you know, we could set up more of a phone bank system internally if needed.
Yeah, well, we can talk about it later, but I thought that would be a way to kind of ease the load.
Yeah, definitely interested. So let me know if and when you want to chat about that more.
Okay.
Thank you.
Thank you, Brandy. The next topic?
That's all I have for communication.
Oh, okay. There was a statement of economic interest on there and building security assessment. I'm sorry, I've got the wrong one.
Okay.
All righty.
Those two things are taken care of, thankfully.
I thought so. Financial statements?
Okay, this report is through the end of July, so we were 67% into the fiscal year. Accounts receivable is at $750,000. Deferred revenue at $710,000. That number is increased because we did receive a large payment for the contact tracing grant upfront. So that's why that one looks a lot higher than usual. The ending fund balance for the end of July is a little over $5 million. Then the next page, total revenue, we are at $4.2 million, which is 64.9% into the total budget. And total expenditures at $3.9 million, which is 61% into the budgeted expenditures. I also want to add that our budget presentation will need to be at the next board meeting, so we'll also need to schedule a finance meeting for next month. So we can reach out by email and set that up and do that on Teams as well.
Okay.
If you have any questions, I can answer.
Thank you, Sheree.
Thank you. We don't have to approve that, right? Or vote on it?
Yeah, the acceptance, we
Yeah.
have to vote on it. Yeah.
Okay. Roll call, please. I guess I need a motion, sorry.
Page will motion.
Okay, second.
Aye.
All right. All in favor of accepting the finance report? Roll call?
Candace Clevenger,
Yes.
Paige Toth,
Yeah, sorry, I couldn't get off mute.
Vivian Goodman,
Yes.
Dr. Turger,
Yes.
Mary Jane Linton,
Yes.
Dr. Patterson,
Yes.
and Laura Zimmerman.
Yes.
Okay, you have a list of the department expenditures? Does anybody have any questions for staff?
No.
I need a motion to approve the bills for payment.
Laura, so moved.
Thank you.
Janet, second.
Thank you. Roll call vote, please.
Candace Clevenger,
Yes.
Paige Toth,
Yes.
Vivian Goodman,
Yes.
Dr. Turger,
Yes.
Mary Jane Linton,
Yes.
Dr. Patterson,
Yes.
and Laura Zimmerman.
Yes.
Are there any grant applications for review?
No.
Included in your packet were Department Division reports. Do you have any questions for staff?
Candy, I did want to say, Sandy was going to email Carol's report. So you all should have that or will after the meeting, Carol's statistics for her division.
All right, we do have them.
Okay, great.
She got that done. Okay, we're at employee recognition. We have Whitney Allison, 6 years. Catherine Marley, 6 years. Sarah Stoutenborough, 5 years. Cece Jinks, 3 years. Rebecca Smith, 3 years. Stoling Stark, 1 year. Sorry about that. Thank you for your service. I also wanted to thank all the staff for all their hard work, especially the directors and you, Brandy, and assistant administrator for all you've done during this time. I know it's been a lot of work, and I do want to recognize you all too for all you've done. So thank you.
Thank you.
Incredible job.
All right, any old business?
I just wanted to give you all a Board of Health member update. As you know, you all approved Sue Crows last month. She was very happy to hear that and quickly completed the Board of Health member interest form, which we submitted to the county July 29th. Unfortunately, the chairman did not review or approve or submit that to the full county board for August. So I did let Sue know that and let her know that hopefully in September that will all go through. And I did reach out directly to Kevin Greenfield just to ask if he could please get that one through in September, since it's really important for us not to have a gap, especially right now. So hopefully we'll have her taken care of all the way in September. But she's been very much on top of it. She's very excited and happy. So as soon as we can get that through, then we will have a full board again. And that's all I have for old business.
Great, thank you. Any new business?
No.
So I need a motion to adjourn.
I so move.
And the second,
Page will second.
a vote?
Candace Clevenger,
Yes.
Paige Toth.
Yep.
Vivian Goodman,
Yes.
Dr. Jerger,
Yes.
Mary Jane Linton,
Yes.
Dr. Patterson,
Yes.
and Laura Zimmerman.
Yes.
Thank you all so much for being on this evening. I hope you have a good rest of your day.
All right, thank you.
All right, take
you.
care.
You too.
Bye-bye.
Bye-bye. Brandy,
Thank you.
Brandy. Brandy is gone. Okay. Bethany.
Yeah.